With the news at 11, our top story is the focus on COVID, coronavirus, the scare that people are feeling, and government is also putting out its own guidelines and own advisories to states about what the way ahead should be. So what is it that we have for you? We're starting off with the COVID alert that is being issued. Government has said that there should be maximum awareness. People should be wearing masks, social distancing must be maintained. And this is because of the cases that we have seen in China, that government has put everyone on alert. There is a press conference that Mansukh Mandaviya is also scheduled to take. And I have Shireen Elizabeth joining me right now. Shireen, just take us through about what exactly the government is planning at this stage. What is the thought process in the Health Ministry?
A number of measures are going to be implemented, though the Health Ministry has been saying that there is in fact no need to panic. The situation is much better in India, but at the same time we need to be well prepared, we need to be vigilant. And keeping all this in mind, there is going to be in fact a mock drill that is going to be done on Tuesday across the country. Now today at about 3 p.m. is when the Health Minister is having a meeting with all the state health ministers. In this particular meeting, they will in fact be told how they have to go about this mock drill. Now the whole purpose of the mock drill is it will in fact be imitated that a COVID patient entering the hospital, the testing being done, after that seeing his or her symptoms, he is in fact been admitted, whether he needs an ICU ventilator, how is he or she is being checked, after that the care, the treatment needed, all these measures will be taken in the mock drill. The whole purpose of the mock drill is that to ensure that such COVID facilities, be it the hospitals or healthcare centers, are well prepared to face any kind of situation that comes in the future. Though as of now India is in a much better position, but at the same time we have to be very vigilant, and keeping that in mind, the Health Ministry is also going to release a fresh guideline. Yesterday we have seen a guideline for the airports have in fact been released, where it was said that this random 2% sampling, test sampling will be done. Apart from that, thermal screening will be done, and also the positive cases of the passengers, those samples will in fact be sent to genome sequencing. But now there is going to be a fresh guideline like an advisory also, because remember the sources within the Health Ministry has been telling us that they don't want to make anything a mandatory now, because the situation is much better. 0.1% is the positivity rate, hence they want people to voluntarily obey or follow the protocol and rules that are going to be put by the Health Ministry. So keeping in mind the Christmas and New Year, Health Ministry is going to issue a fresh guideline.
Right, and you spoke about the guidelines at the airport. Yash Goyal is there at the airport as well. IGI is where he's joining us from. Yash, when you look around, do you see more and more passengers, especially at the arrival lounge, wearing that mask and coming out? Any chance of speaking to them about random testing, about the experience inside?
Well, Arunima, I'll directly go to the visuals about the mask situation over here. You can see people are coming in swift numbers out of this international arrival, and you can see most of these people, you can barely see anyone masked up over here. And in fact, we were talking to certain people also who were coming from this very terminal. They were saying that as of now, things are moving swiftly inside. They've been, when they actually board the train, flights, they were asked for certain vaccine certifications. But from tomorrow is the date, 10 a.m. is the time when these guidelines will be put in place at all the international airports in India. And in fact, we need to understand this entire process. This starts from the point when the person boards the flight, and at that point that person needs to provide a certificate, a vaccine certificate to the authorities. And when that person is on board, the authorities has to make sure that social distancing is being followed, the people are masked up. And once they deboard the flight, here at international airports, thermal scanning will be done of all those people. And in case if somebody found to be infected with COVID-19 in random testing, that person will be taken into isolation and will be sent to nearby health facilities. Per se, if I'm here at the international airport in Delhi, he'll be sent to the nearest health facility which is available from the international airport. And in fact, once the authorities have confirmed the COVID, the positive report, then that particular sample will be sent for genome sequencing. Genome sequencing becomes very crucial at this point because the variant which is wreaking havoc in China, the BF7 is particularly which the authorities will be looking after, because as of now in India there were 4 positive cases of this particular variant, and now what we are given to understand, all those patients who have been infected by this particular variant have been recovered and they are doing well now. So this entire process of maintaining social distancing at airports and maintaining that all the passengers who are coming from international destinations arrive in India with a sound COVID report and they come into the airport fully vaccinated, so no untoward situation or a bad situation could arise in the future.
Shireen, coming on that, like Yash is also reporting, there were 4 people reported with that variant which is causing havoc in China. All 4 have recuperated, they're fine, in good health now. So then in terms of numbers, what has really changed in the last 1 week that has led to so much of concern in the corridors of Delhi, in North Block, South Block and also in Shastri Bhavan?
Well, nothing has changed in terms of the numbers. In fact, we are seeing a decline for past few months altogether. The positivity rate is also in fact 0.1%. What really has changed is that the cases in China, Japan, Korea is increasing. The international routes are open. Passengers are coming in to India. The Indians are in fact traveling to other countries. They are coming back to India. So keeping all this in mind, because at the end of the day, COVID-19 is a very unpredictable virus, and the kind of mutation it takes, because when we talk about Omicron, Omicron itself has in fact 150 subvariants, and we never know which variant could actually create havoc, because if you see the difference, the BF7 in China is creating havoc, whereas in India 4 cases have recovered and they are very well, is what the health ministry is saying. There is no, the situation there, health has in fact been, is better, is what the health ministry is saying. But it all depends on the dynamics, it all depends on the herd immunity that is achieved in each of the country. We have natural immunity, our vaccination coverage is much better. Keeping all this in mind, we are in a much better situation. But that doesn't mean that we are not supposed to be vigilant, we are not supposed to be alert. And that is exactly what the government is doing. They don't want to leave any stone unturned to make sure that the infection, in case it spreads in the future, is contained at the right time with the right measures taken on ground.
Talking of right measures, Yash, we spoke about arrival. Did you get a chance to go through departure or speak to anybody in departure? Why I ask you is because just about 7 or 8 days ago, there were long queues outside departure terminal. Social distancing is what government is now advising people to do. Standing in a long queue for a long time, if you are standing with an infected person, could mean trouble. So in terms of those dynamics, what can you tell us from departure side?
Well, in fact, Arunima, at departures and at arrivals, the situation remains to be very calm as of now, and the people are moving very swiftly, and at departures as well. We have seen earlier there were long queues, in fact, because of the situation which has arisen at this particular airport, and now things are moving very swiftly, and authorities are also maintaining, making sure that the crowd is maintaining the social distance and they are wearing masks so as to nobody gets infected. So situation at the ground, I'll show you the visuals. You can see from here also. At arrivals also, the doors are maximally cleared, and in fact there are security personnel also. There are also private security agencies who are at the doors to maintain that no cluster of people actually gather at one point of place. And in fact, owing to those guidelines which the government has issued, tomorrow we'll be seeing those guidelines will come in place, and we can expect that once those guidelines are in place, things become more smoother, because it will also give more clarity to the authorities as to what process they have to follow.
All right, Yash and Shireen, I request you to hold on there, because this has also led to a lot of political